So when I first heard of ketamine being given in anything other than a hospital setting was when Elijah McClain died. And I could not imagine using this medication outside of the very controlled environment in which I had given it as a resident with a team of doctors and nurses, let alone in a situation that may not have been medically necessary. Thank you, Madam Chair, and thank you, members, for a very healthy and respectful debate on what can be a very difficult issue. I think that what has been left out of the discussion is the medication itself and the patient it is administered to. The patient who is the one who is going to have adverse reactions if they occur. And as Representative Mullica said, I think there's probably only 2 of us who have administered this medication to a human being. And I remember the first time that I used ketamine. It was a 16, 17-year-old boy. I don't remember exactly what had happened. I was in residency. It was my second year in residency, and we were in a sedation team. Sedation we took so seriously that there was an entire group of doctors that were devoted solely to that procedure, while the other doctors dealt with whatever it was that was going on with the patient. So we heard about a young man whose leg was very severely broken. They needed to be put in traction. And so we went down to the emergency room. This was a group of pediatricians because we're treating a child, and so pediatricians should take care of children. And so we came downstairs and asked, well, you need sedation. Is there anything that you would prefer? And in the emergency room, they like to use ketamine because it is fast. But there are also a lot of side effects and a lot of behaviors that a patient goes through that perhaps those of us in the hospital, in another setting, or certainly in pediatrics, were not overly fond of. So we came in and his leg was pointing in the wrong direction, and he needed to be put in traction. So this was the first time that I had ever given ketamine, and there was a supervising resident and a team of nurses and 2 other doctors who were going to be putting his leg into traction. So we gave the medication, and I remember, like Representative Mullica, being scared about what the medication itself was doing. It is very common for these individuals to have what we call roving eye movements. They look like they are suffering. Their eyes are moving crazily, basically, in their heads. They look agitated. It is very common. Thank you, Madam Chair. It is very common for them to be paranoid. They tend to have hallucinations, and this young man was clearly having hallucinations. Some of the things that he said were actually kind of amusing, but definitely there was a level of tension about the fact that we were using a medication that could the patient have been more comfortable with something like midazolam or something else? Probably, but this was the medication that we were using. It can also cause nausea. So you don't really want a patient vomiting on you when you're trying to administer a different procedure. And it's actually quite common for them for it to affect their breathing. Their oxygen level goes down. And so what do we do when somebody's starting to have trouble breathing? We start to think about intubating them. The problem with ketamine is that it does a lot of other things that can get in the way with intubation, including hypersalivation, so you're drooling like crazy. Your throat will spasm. Sometimes your vocal cords will close up. And that's what you have to get through to put that tube down to allow them to breathe with your help. So when I first heard of ketamine being given in anything other than a hospital setting was when Elijah McClain died. And I could not imagine using this medication outside of the very controlled environment in which I had given it as a resident with a team of doctors and nurses, let alone in a situation that may not have been medically necessary. Because in addition to everything that I've talked about and how scary it is for the patient, how scary it is for the provider, how hard it makes it to intubate people, intubation and serious adverse effects are very common with this medication. We heard paramedics and EMTs, which by the way, only paramedics can administer this medication, not EMTs, because of their level of training. We heard paramedics talk about the level of complications, and it ends up being about 1 in 4. If I had any kind of procedure that I was performing as a pediatrician where 1 in 4 of my patients were going to suffer a serious reaction and probably end up going to the hospital, I can guarantee you I would not be a pediatrician anymore. As a legislature, if we heard of procedures happening in hospitals, in clinics, through any kind of medical provider, where 1 in 4 of patients might suffer a serious consequence, I am pretty sure we would be doing something about it. And that is what we are doing today. 2/3 of patients who are administered this medication outside of the hospital, according to one study, ended up intubated. That's more than 16 times higher than the number of patients who end up intubated when there is a proper team taking care of these patients in a proper medical environment with proper equipment to look at vital signs and to have intubation ready if it is needed. Now, I am not saying that there is not proper medical care that's happening outside of the hospital. It's just very different medical care. And I have spoken to a lot of these providers who have had to give ketamine in these instances, including firefighters. And firefighters who have been accused of being murderers, honestly, because of their involvement in the care of some of these patients. And that is not fair. These are individuals who are not there to apprehend, they are not there to enforce any laws. They are there to preserve the health and the safety of an individual who, once they are on the scene, and they told us this in the committee hearing, is a patient. They are no longer just a suspect. They are no longer somebody who is acting funny. They are now their patient. And so to put a medical provider in a situation where perhaps it's not just their medical decision that leads to the use of a medication that can have very serious consequences is not fair. Why does this bill relate only to instances where there is a medical provider, where there's a law enforcement provider on the scene? Because otherwise there is no other influence. The only person who is deciding the use of these medications in that instance is the medical provider. A medical provider who is trained in the use of the medication, who is trained in how to intubate people, who knows how to deal with the emergency situation, but maybe would not have made that decision if it were not for the presence and influence, however you define that, of someone else. These decisions are medical decisions. They need to stay with medical providers, not with individuals who do not have training in what the consequences of these medications are. I ask for an aye vote.